name's Adam and this is Claudia, and today we're talking about how you can use Dr. K Kinesiology to help with shin splints. So shin splints is an injury that happens as a result of repetitive stress and overuse, usually from poor mechanics or high load on hard surfaces, perhaps courts or hard grounds. The way the tape can be effectively used is to try and support the muscles that are overloaded and decompress some of the painful tissue around the injured area. So the first thing we're going to do is measure the length of the tape. So we're going to run a piece that starts on that little bony bump on the outside of your foot, which you can feel on that sort of edge of the midfoot. We're going to follow around to about sort of halfway up the shin, bearing in mind that the tape's going to be longer when stretched than it is when you're cutting. Cut along there, and then we're going to cut our corners off as usual to prevent peeling around the edges. And to start off our anchor piece, we're going to make a little fold and then tear on that folded line, and then peel back the tape to create a little tab that we can then use to peel the tape off. We can peel that piece off there to expose the remaining tape, and that's going to become our anchor, and we're trying to avoid to touch that as best we can. Claudia's going to help from there. So we're going to feed that piece under our foot, find that little bony bump on the side there, and try and line the tape up on the angle that it's going to come around the corner. So stick that tape down, and we're going to use find our little tab. So bring that hand around, yep. Find a little tab there, peel it back a little bit just to expose some tape, and then that's going to stick down onto the skin without any actual tension. And then peel all the way up with the tape from there, and holding with one hand, we're going to come around the corner there on about 50% tension the whole way along. Once we've turned the corner, we're going to aim to run up the inside of the shin, lining the tape up with the edge of that bony portion of your shin there. Run the length of the shin, and the last little portion of the tape is going to go on without any tension. So we're going to make sure that our tapes finishes the last little bit with no tension. Give it a rub to make sure it sticks properly. And then in addition to that, you can use some horizontal corrective pieces to allow for more decompression at areas of pain. So depending on what type of pain you've got with this sort of injury, you can anchor your decompressing points all the way along. You can use more than one if you want to as well. So if we're going to, let's say we'll just do one across sort of that lower third of the shin. Doesn't have to be too wide a piece. Cut the length, trim the corners. We're going to tear in the middle for this one. So we're going to create a situation where we're going to pull the corners back and then pull that really tight, so about 75% tension. So Claudia can do this a little bit of it. Hold on the paper, about 75% tension, stick it down over the pain site, leave the tabs at the end free so that you can peel them off and lay them down without any tension to finish. Give it a rub and we're done. So the important thing for any sort of application is to make sure the tape stays on. So for areas around ankles and shins, we want to make sure that we're not peeling the tape off when putting socks and clothing on, ensuring that we're not losing the tape in the shower, so when we're drying ourselves we pat dry rather than rubbing. Same thing in bed, sometimes wearing a sock in bed helps over an ankle and a shin to minimise the likelihood of the tape coming off when contacting with sheets. Avoiding using lotions, moisturisers, excessive hair removal, and making sure you give it a good rub to cause the adhesive to bond effectively to make sure that works well. For shin splints, it's a problem that needs a bit of evaluation to determine the nature of the injury and also what the best method of treatment is. So usually it's related to poor biomechanics or some sort of an overuse context which needs to be investigated and explored. So further intervention and further investigation are usually warranted in these circumstances. Supplementary treatments can be things like ice, massage, anti-inflammatories, and trying to address some of the mechanical issues that are underpinning the problem in the first place. So for more information about Dr. K Kinesiology Tape, visit sportstrap.com.au.